My name is Janet Malik, and I am the Associate Director of the Fellowship Program at Baylor College of Medicine. We are thrilled to have you with us today to talk a little bit about one of our very favorite programs, which is our Clinical Ethics Fellowship Program. Just a couple of housekeeping items. Just make sure, because this is a webinar, you have the option to put your questions in the Q&A box, which is down at the right on your screen, or at least it should be. And so we will potentially answer any questions that you might have along the way, but most likely we will try to keep them all toward the end. So we're just going to spend the next maybe 35 or 40 minutes talking a little bit about the fellowship, and then we will, as I said, allow time for questions. So the plan for that time is just to give you a big picture overview of what we see as our goals for the fellowship. Then I'm going to hand it off to Dr. Trevor Bibler, who is going to talk a bit about some of the specifics relating to the training that you would receive during your time here. We will then hand it off to give you a little bit of insight into what our center is like here at Baylor College of Medicine and the Center for Medical Ethics and Health Policy, a little bit about Houston, and then finish up just by talking a little bit about what we're looking for in a fellow and how we see our program as being different from some of the other clinical ethics programs. So on a very high level, one reason that we just absolutely love this program is because we see this as a win-win-win for everybody. Obviously, one of our goals in doing a fellowship is to provide an opportunity for our fellows to come and learn to do clinical ethics. But just as much, we see this as a huge benefit to our program, to have new minds coming in every year and sharing new ideas and asking new questions really helps us as a program to keep making ourselves better and expanding our horizons. And we also see this as meeting a huge need in the field of bioethics. Not every fellow that comes through will end up doing clinical ethics, but there is a huge demand for folks to be working in hospitals and providing guidance for clinicians and patients and families. But even if you end up not working in the clinic, we see it as a huge benefit to the field of bioethics to have people who have had experience and who are really understanding the dilemmas that folks are facing on the ground. So we explore, we sort of try to achieve that goal of our win-win-win by doing a different array of activities. Dr. Bibler will talk a little bit more about that in a minute, but essentially we see the fellows as largely participating in clinical ethics training, followed by the gathering of experience. So our fellows come out having had done probably upwards of 100 consults. So they are well prepared to move on and function independently in other places. But we also want to focus on making sure you have some opportunity to do some scholarly publications, as well as teaching, to make sure that we have fellows who are very well-rounded and prepared for lots of different types of employment. So with that, I will hand it off. Dr. Bibler, you want to go ahead?
Sure. Thank you very much. So I'll be talking about some of the training specifics. I'll be talking about our primary training site, giving you a little bit of detail on that. Then we'll talk about the clinical ethics training itself, followed by some of the teaching and research that fellows have the opportunity to do. And then I'll hand it over to Dr. Robertson Preidler, Joelle, to talk a little bit about the day in the life of a fellow. So Houston Methodist Hospital, you see a photo of our newest tower, Walter Tower, here. That is the primary training site for our clinical ethics fellows. It is, all told, the HMH Houston Methodist Hospital system has, I believe, over 2,000 beds, and I believe 800 to 900 beds as part of the main TMC, or Texas Medical Center the main flagship hospital. And that's where you would be doing most of your shadowing and consult work. The fellow would also be participating in educational events at Houston Methodist, which would include bioethics grand rounds, including not just participating, but actually leading them at some point during their fellowship, and then participating in the biomedical ethics committee at Houston Methodist Hospital directly. So that's a little bit on the main training site. But when we're thinking about what the clinical ethics fellowship training does specifically, we thought it'd be good to highlight a few things. First, overall goal, what is it? Well, it's that the fellow become a good clinical ethicist with really the ability to identify and analyze, but hopefully also resolve ethical conflicts and uncertainty that we see at the bedside. And we really envision two overlapping but distinct training periods as part of the clinical ethics training that we do here. The first training period, we really take the fellow from being interested and invested, I suppose, in clinical ethics to being independent or competent in the ability to do clinical ethics consultations at Houston Methodist Hospital. But then the second training period, that's really where we do our best to take the clinical ethics fellow from independent or competent to proficient. And I can talk more about the details of that if that's interesting. But what it really does is it gives the fellow the chance to get acquainted with one hospital system and then build to the point of feeling as though and actually being able to provide ethics consultations at other institutions as well. That's the second period. So some details about the first training period. Usually that goes from July of December for our upcoming cohort, it'd be July 2022 to December of 2022. And what we do is we take a stepwise and conscientious approach to training our clinical ethics fellows. You would begin just shadowing, just watching the clinical ethicist do their daily work. Then over time, over those 6 months, what we try to do is have our fellows become gradually integrated into the consults themselves, all the way from at the beginning, just maybe providing a clinical update to a friendly social worker that we know, all the way toward the end of that to really leading the consults with the clinical mentor, kind of being in the background, jumping in periodically, but really expecting the fellow to lead all aspects of the consults, from the information gathering to the analysis, to the family meetings, to the recommendations, all of that. And then hopefully by late December or so, the clinical ethicist fellow would be able to do independent consultations. That's the goal. Since our program is really created more around benchmarks and competencies, this is a general timeframe that we've had a great deal of success with, but it's more about being able to do these activities than the timeframe itself. Which leads us then to the second training period, which happens over the rest of the fellowship, beginning in January, sometime around there. That's where the clinical ethics fellow would be working independently, but they would also have team support, especially on challenging cases. Many times I've talked with fellows, and as faculty, we talk with each other as well about especially challenging cases. We run our analyses by each other. We provide support with practical recommendations about, let's say, framing a conversation or helpful prompting questions, things like that, where we're definitely in communication when we have challenging cases. And as part of this second training period, I also do 2 to 4 evaluations just to make sure that the fellow is really progressing in a way that we would feel comfortable not only saying, okay, yep, you're good to go here at Houston Methodist, but again, the bulk of the clinical training actually is oriented around the question, around the benchmarks that it would take in order to do good ethics consultation at other institutions. So that's a little bit about the clinical ethics training. Next, let's talk about the teaching opportunities. We'll divide this into two areas. First, let's talk a little bit about content. So the ethics fellow has lots of opportunity to do teaching in clinical ethics and medical ethics. And sometimes the teaching would be around already established content. An example here is we do a half hour every 2 to 3 months for a fundamentals of critical care support group run by the Society for Critical Care Medicine that Houston Methodist puts on. And there's established content dictated by the Society of Critical Care Medicine that we teach for half an hour on critical care ethics. The fellow also has the opportunity to modify already existing content. An example of that would be our moral distress and nursing care sessions, which we put on for our nursing residents a couple times a year. We're soon going to start making some pretty big changes to that, in part in large part prompted by our fellows. So it's the chance for the fellow to really modify what's already there. And this presentation, this example of the moral distress presentation, that's been changing over time, even since when I was here as a fellow in 2014. It's been changing since that time. And then finally, novel content. The fellow has a chance to create novel content in lots of areas. One specific area would be, though, the ethics grand rounds that they would be expected to do. So in addition to the content side, we also have the audience. Okay, so there are three different ways. You would have the chance to reach many audiences as part of the fellowship. Three examples here, nice little categories, would be HMH and Baylor St. Luke's in-house staff, which could include doctors, nurses, chaplains, social worker, any member of the staff. That's where you might do your ethics grand rounds. Also, there's the opportunity for education and teaching with community and other healthcare facilities. An example of that is our fellows annually put on an hour to 2 hour conversation for the Houston Association for Communication Disorders and Speech Pathology. And then finally, our fellows have the responsibility of helping to co-teach primarily via small group co-leading activities. All of the first year Baylor College of Medicine medical students are required to take a course in medical ethics. So our fellows co-lead every Friday, early afternoon, they co-lead hour-long sessions as part of that. So then finally, let's talk a little bit about research. On your research, you really have, the fellow has most time to do research between weeks on call. Our consultation service is so busy that there's really not a whole lot of time for in-depth research during the 2 weeks that the fellow would be on call. But it's not 100% call all of the time. It's what we try to aim for is the fellow being on for 2 weeks, then off call for 2 weeks. And even built into that, in addition to those 2 weeks off call, hopefully, that's again the ideal, we also have about 2 per every 12 months of research dedicated time for the fellow. That's where they don't have those 2 weeks on for that part. So you end up having 5 to 6 weeks of just pure research time per year to really dive into your work. We really value fellows who have the ability to collaborate with the other fellows, and we really value fellows who show promise in being able to do collaborative work with BCM faculty. And then finally, the responsibility in order to complete the fellowship is that the fellow, by the end of it, have submitted 2 first authored publications to peer review journals. Not accepted, but at least submitted. So now with that, I will turn it over to Joelle, Dr. Robertson-Preidler, who is one of our second year fellows, to talk a little bit more with y'all about what a day in the life of the fellow actually looks like.
Hi, I'm Joelle. I'm a second year clinical ethics fellow. That means I went through the first training period of with Dr. Bibler to learn my clinical ethics. And then I've done about 8 months of independent clinical ethics work since then. So I wanted to give you a little overview of what it looks like to be on call as a fellow, but also it's like to be off call. And I'll try to be as practical as possible, just taking you through my day. So when we're on call and we're doing clinical ethics work, we're expected to be either in the office, taking calls, writing notes, or in the hospital from about 8:30 to 5. And what a typical day will look like is you might come into the office, maybe you need to grab a cup of coffee. You'll do any kind of meetings that you need to do. So like it says here on Monday, we have handoff where the person going off call will give remaining cases to the person going on call. And actually all of our clinical ethics group attends that so we can kind of see these cases evolve over time. We also on Tuesday, we have the medical review board meetings where physicians discuss candidates for transplant. And we see that many ethical issues arise during these discussions. So we're there to be an ethics presence. And after these meetings, typically what I will do is I'll look through my cases, the ones that have been handed off to me and any new ones that have come in, and I'll do a chart review to see if there's anything new going on with these patients before heading off to rounds. So we do rounds in 2 different ICU units in Houston Methodist. And it's really important that we're kind of there for these interdisciplinary rounds where we go from patient to patient, talking with social workers, physicians, nutritionalists, pharmacists, to get really a good overview of each of these patients, to be that ethics presence on the floor and to even be able to answer questions on the spot and do some preventative ethics as well. After rounds, you'll do the other clinical ethics activities, which might include anything from gathering information to family meetings, talking, or going back to the office and writing notes, anything that you've done during the day that needs to be documented. So that's what it looks like to be on call. When you're off call, these weeks are typically dedicated to research, but there's a lot of other activities that you do as well. These hours are more flexible, and since the pandemic, they've been even more flexible since a lot of our meetings are virtual. But you are expected to be at all these meetings and activities. You do a lot of teaching in the hospital and for Baylor College of Medicine as well. And the exciting thing about being off call is that you can get as involved in different research projects as you want. So your mentors will help you develop your own fellowship research program, but you can also collaborate with a lot of different people as well. You'll be attending many meetings, and it's kind of like a choose your own adventure novel, if I'm not dating myself too much, where if you're really interested in something, you want to teach something, you can do that. If you want to create something new, like we just developed a writing accountability group for the fellows, and we meet once a week. That was totally on our initiative. You can, if you complain about curriculum enough, then you start to revamp it. And so it's really what you make it. As long as you fulfill the criteria for the fellowship, you can do more. So that's really exciting about this fellowship.
I think this is where I step in. So I'm Mary Majumdar. I am the academic mentor for the fellows. And just to give you a little background, so first, living in Houston, we are a very green city. There are live oaks everywhere. It's actually quite lovely. And if you're a runner, several large parks that have places to do that activity. Lots of cultural opportunities, professional sports teams. And Trevor would be mad at me if I didn't also mention, in addition to the three listed here, the Houston Dynamo, our Major League Soccer club. And then we have a lot of foodies in the center. And that's perhaps because food is very interesting and fun, but also because there are a wealth of restaurants in the Houston area. It's a very diverse city, and the cost of living is very reasonable. And so you can afford to eat out and sample lots of different cuisines. Next slide. So Trevor or Dr. Bibler mentioned the TMC, the Texas Medical Center, which you see here. It's really big in keeping with the Texas spirit. So there are 54 separate institutions, and pre-pandemic, at least, the daytime population was about 70,000 people when you combine patients as well as medical professionals and staff. Baylor College of Medicine, if you advance, I will get a little pop-up that will show you roughly where our main campus is situated, and our center is on the main campus, but there is also a new campus to the southeast that includes some outpatient facilities, and if you advance, that will pop up too. So the newer buildings are down there. Baylor as a whole has over 5,000 faculty members if you include full-time and part-time and voluntary clinical faculty. And our education mission, the medical students were mentioned earlier. We also have a graduate school of biomedical sciences and the National School of Tropical Medicine. Peter Hotez, who you may have seen making the rounds in the context of the COVID pandemic, is the dean of the National School of Tropical Medicine. And then we have health profession students that are training to be physician assistants, nurse midwives, and genetic counselors, as well as residents and fellows, of course. And I'm going to talk a little bit more, but be very brief, about research in our center. But overall, Baylor is ranked 20th in the country for NIH funding for research. Oh, I should also mention, because this often comes up, that Baylor College of Medicine separated from Baylor University in 1969. And so we are a freestanding academic medical center. This is a picture of our center faculty. Our center was founded in 1982, so it's been around for a while. And I just typed up our vision or mission statement. It's to create a shared, sustainable intellectual environment in which all stakeholders can critically reflect on and respond to ethical challenges in healthcare and biomedical research. We have 18 primary faculty members, shown here, 31 secondary faculty, 24 affiliated scholars, and over 40 fellows and staff members. Next slide, please. So we've already talked about consultation and the role the fellows play in education. We do a lot of research, and that's the focus of the next slide. I'll also mention our outreach programs. Baylor supports several schools that are part of the Houston Independent School District. And so that's one of our efforts, as well as doing things like group volunteering at the Houston Food Bank. In terms of our research programs, so we have one of the largest genome centers in the country. That's a big piece of Baylor's research generally. And related to that, we have a very strong program looking at the ethical, legal, and social implications of genetic and genomic research and translation into the clinic. We have a neuroethics program that focuses on things like deep brain stimulation, and we receive funding through the Brain Initiative for that work. We have a medical decision program that's been funded in part through PCORI, the Patient-Centered Outcomes Research Initiative, I believe, but don't test me on that or hold me accountable for getting that correct. We also have a program that looks at health and science policy, things like gene drives. And then we have a newer program that is looking at social determinants of health, health equity, and public health ethics. Our center culture is really important, and we've tried to keep that strong through finding some way to do most, if not all, of our activities, even during the pandemic, to create this community. So we have developing and issues in bioethics and society seminars, a big topics in ethics and policy journal club that the fellows have as one of their projects to lead a session of that journal club. We have regular works in progress and career development sessions. So in addition to the fellows writing accountability group, we have this way to get feedback on your work from the entire center and to pose your questions about career development. We have regular clinical case conferences. Again, the fellows play a role in leading some of those sessions. We used to have biweekly Tuesday teas, which were opportunities to gather and drink tea, and somebody would kind of adopt a day. Our replacement for that, while some of us are still out of the office, is a biweekly check-in. And I was just trying to, it's really interesting. People volunteered, so there are updates, but then people take turns presenting a topic. And we've had a lot on food. When I made a list, we've had restaurants, recipes, cultural holidays that also have a connection to food, favorite things to do in Houston, TikTok, nerdy obsessions. And at least some of those resources or presentations are now archived as resources, since there's been some really great information. Also birthday celebrations and summer and holiday parties. Again, some versions of those things continuing even during the pandemic, but great opportunities in non-pandemic years to get together with colleagues and form community. And then finally, center-wide retreats. And then I have just a few images. So we have center intentions, which you cannot possibly read on this slide, but some examples are interact with everyone in the center and be transparent with updates and decisions, support each other and have each other's back in all situations, and be reflective and mindful of issues related to diversity. So this is our gong when we're in the office, when somebody gets a paper accepted, grant proposal funded, or just has a really good day and wants to celebrate it, whoever's around will gather and will gong it and write it in the book. And then finally, this isn't finally, but our efforts at office beautification. Here you see one of them. And then now finally, I think, Yes. So still memorable, the Tuesday tea, where Karen brought in her Yonana machine. And so that inspired some people to create like a banana art installation in the center that's still there. So again, we really like food, and also it's a pretty creative place. So I hope this gets across that it's a pretty great environment. With that, I think I am done. Am I correct? Is the next slide? Yes, turning it back over to Dr. Malik.
Yes, thank you. All right. So we're moving pretty quickly through our plan for today, but I do want to spend a couple minutes sort of giving and getting information that might help you to figure out whether this fellowship is the right kind of fit for you. So a terminal degree, I see somebody actually put in the chat, is having a terminal degree a requirement? And the answer is yes. We do expect all of our fellows to have a doctoral level degree, which can be an MD, a JD, or a PhD, or an EDD, or there's several other BE, CD, there's a lot of them. But essentially, we do expect it to be a doctoral level degree. We're looking for established interest in clinical ethics. Now, we realize, especially with the pandemic, that it's been difficult for folks to get the kind of exposure that they might otherwise be able to get in a hospital. But we do want to see a sort of pattern of interest in clinical ethics, not somebody who's like kind of trying to change their whole trajectory kind of at the last minute, but somebody who has shown an interest either by taking classes related to clinical ethics or doing some scholarship related to clinical ethics. There's different ways of showing that interest, but we are going to be looking for that when we're reviewing applications. We are looking for some sort of training in ethics or bioethics. Many of our fellows have come through philosophy programs and have gotten their degrees in ethics-related disciplines, but not everybody. We've had folks come in from bioethics and social work. We've had folks come in with a JD, with a health policy background. So all kinds of different backgrounds, but there has to be something that's at least related enough to ethics that we will be confident you'll be able to do ethical analysis when you are in the clinic. Related to that, and again, as I said, we understand with the pandemic, clinical experience might be something that has been harder to get. So we might be a little bit more flexible with that this year. But we really hope that you've had enough experience in a hospital environment that you know whether you're going to like it or hate it. I think a lot of times people get into the clinical environment and realize this is very different from the philosophy department where I've spent my last 6 years. And some people absolutely love that, and some have found it challenging. So we want to make sure that you have at least some knowledge of what the environment is going to look like that you're going to walk into. And finally, as I hope has become apparent through our conversations, collegiality is incredibly important. I think having a strong team to be able to do this kind of difficult and interesting work is incredibly important. And so we are going to be looking for somebody who's going to be a great member of our team. Now, what about our program, and why should you think that this might be your top choice of where you would want to do this kind of a fellowship? Most of our training takes place at Houston Methodist Hospital, but we also have an opportunity to do work at 2 other hospitals throughout the time of the fellowship. But at Houston Methodist, where we do most of our work, we have a very high consult volume. So we do between 450, well, really between 400 and 500 consults a year. We're looking probably closer to 500 this year. So what that means is every week when a fellow is on call, they have an opportunity to see probably 10 to 12 cases, which really does give them an opportunity to see the variety of types of consults that they might get. We also have very extensive, at the hospital, they have ECMO, they do transplants, they have all kinds of high-tech and low-tech interventions that we have a chance to interact with. So you have a great chance to learn a lot of get a lot of different experience at Methodist, and then also to apply that in at Cornell during that. Oh, I'm getting ahead of myself. Part of my consortium thing there. Okay, so high volume, lots of experience. Protected time for research. The fact that we allow for these 2 1-month blocks during each of your fellowship years should give you an opportunity to focus in on and really accomplish that goal of getting 2 papers out to peer-reviewed journals during your time here. Those of you, and our fellows might want to jump in and sort of talk about their experience with this as well. But going from being in the clinic to having some time when you are not on call can take a little bit of an adjustment. And sometimes when you only have those 2 weeks in between call blocks, it's hard to really settle in to getting some good deep work done on your research. So that's why we have allocated those protected research blocks. As I mentioned at the beginning, we really take a holistic approach to our training, not just in clinical ethics. We want to make sure that you've also had research and teaching experience. We've had fellows from a lot of different disciplines and have prepared fellows to go into a lot of different areas and different jobs. So we think that sort of meeting each of our fellows where they're at and trying to make sure that during the time they're with us, we make sure that they have the exposure and the experience they need to get the kind of job that they want. And again, maybe this is something I would let our fellows jump in and talk a little bit about. With our mentorship structure between Dr. Bibler and Dr. Majumdar and myself, there's a lot of faculty support for our fellows, and we really prioritize making ourselves available. And we also really hope that the fellows will sort of form a cohort. We have our clinical ethics fellows, and we also have research ethics fellows, and they have the opportunity to sort of make a bit of a team amongst themselves and to do activities with each other. So we hope that it is an environment, despite what has been a rough couple of years, where we've still been able to sort of keep the team together. The consortium, I know we didn't talk too much about that. That is an arrangement we have with New York Presbyterian and Cornell. That is a kind of a long story, but essentially Methodist is affiliated with Cornell's medical school. And so our fellows have the opportunity to spend 2 weeks in New York at Cornell and New York Presbyterian with our colleagues up there. So they get the opportunity to see how another service runs. And we've always been interested to hear their observations as they come back. So either in the first or second year, our fellows will have that chance to see how another service works. And then we do a retreat with all of our faculty and fellows to kind of share best practices, talk through new interesting cases, and just kind of have an opportunity to really connect with other colleagues. Finally, Houston. I know before I moved to Houston, I had no idea what it was all about other than it was in Texas. But it is a really incredibly cosmopolitan, culturally diverse setting. It's warm. If you like warm weather, that is a plus for you. It's quite hot over the summer, but the rest of the year is absolutely lovely. And so it's a really interesting place to explore. All right, I do have a couple of questions here. What if you're finishing your degree this December? Would you qualify for applications due in October? Yes. We would just expect you to have the terminal degree before you begin the fellowship next July. I'm from Istanbul, Turkey. I have an MD degree as a neonatologist and bioethics PhD. I am not working as a neonatologist. Would you accept me as a fellow in the department? Yes, a bioethics PhD should be a terminal degree that would allow you to qualify. I'm a pharmacist in Ghana with a PhD, and I've been on an ethics board of a hospital for over 2 years, practiced for 14 years in the hospital and in academia. I believe, yes, you would be eligible. A PhD is a terminal degree, so that should be fine. Some examples of fellows' current research projects, and what is usually the ratio of independent research projects to collaborative research for an individual fellow? That is a great question, and I might pop that over to one of our current fellows if somebody doesn't mind jumping in.
Sure, I can talk, and maybe Aggie might have something to say as well. So our projects usually have to do with a certain topic area where a lot of papers can come from it. So for example, my project kind of centers around the question of how physicians make decisions in the clinic and what factors might motivate them to make certain decisions, especially at the end of life. So that's kind of the broad topic, and there's a lot of papers coming out of that. I have a case commentary that I'm about to submit. With Dr. Malik, I've been working on a qualitative project where we interviewed physicians about end-of-life decisions. And I'm also working on a more philosophical piece about something called social death and perceptions that somebody might not be socially interactive anymore. And so in a way they are dead. And so it would be appropriate to remove care, and kind of questioning that as a relevant ethical factor when determining end-of-life care. So those are just some of the papers that kind of come out of this project topic area for me. And Maggie, do you want to comment on your area of interest?
Yeah, sure. So I just started I'm a first year fellow, so I've been here for about 2 months, and I'm starting now to develop the research project that I'm going to carry out for the remainder of the fellowship. And I'm going to be working on questions related to who should act as a surrogate decision maker, and what sorts of properties or characteristics somebody has to have to exercise the powers of being a surrogate decision maker with genuine moral authority, and what some of the shortcomings are of current practices that use next of kin or close legal relation as a sort of shorthand for being a qualified surrogate decision maker. So far, I'm still working mostly independently, but as an example of, I think, how some of these collaborative opportunities come up, I happened to be in the office one day along with Dr. Preidler, and she mentioned something she was working on. I mentioned something I was working on, and she invited me to write a commentary for something that she had going. So I think little opportunities like that for collaboration will sort of just come up through conversation with people. So if you're maybe a little bit hesitant about working with other people, it really is a very inviting environment where there's just like a culture of openness and collaboration that's pretty rare, and I think really special.
And I'm also going to jump in really quick. I'm Eleanor Gilmore-Zott. I'm also a first-year fellow. In terms of collaborative research, I'm working with Dr. Blumenthal-Barbie on a AHRQ-funded 5-year project looking at data applications of data science to medical decision-making, in particular developing an artificial intelligence to make patient-specific risk predictions for LVADs. So that's I'm from a philosophy background, so that's a really empirical project, and it's new for me, and it's really exciting. And so that's one of the great examples I've seen of something that's been a way for me to grow as a researcher and a scholar in bioethics. And then I'm also working on my own research projects that are more theoretical and related to my dissertation project.
As an example, all of my projects are collaborative. I think it's just important that you're first author on 2 papers, if that's correct, Dr. Malik. But you can work with people on all your projects if you want, and I like that a lot.
We also do try, we try for once a year. It doesn't always happen, but we try to work as an entire team on one paper or project that we're all very interested in. And so anybody on the team is welcome to join in on that. There's also a collaborative project that the fellows do with our New York counterparts. And that is one project that happens collaboratively over the 2 years. So hopefully that answers your question, Marielle. There are a couple of questions about how many fellows are accepted per year. It has varied between 1 and 2. I think for this coming year, it is most likely that we will accept 1 fellow for a 2-year fellowship. But that is always a little bit in flux. All right, a couple of other questions here. I'm a philosophy PhD candidate at Texas A&M, writing my dissertation on ethics and scheduled to graduate in December. What kind of clinical experience could someone like myself gain before applying? So that is a really great and difficult question. I'm trying to think at A&M whether they have any kind of shadowing opportunities. We actually started a bioethics internship for exactly this reason, because we were trying to offer folks an opportunity. And that internship will happen hopefully again this spring. So you can look for that on our website. A&M definitely has a medical school and has folks who do some work in ethics. You might want to reach out and try to see if anybody there is willing to sort of allow shadowing to happen. I don't know, does anybody else have any ideas? I know with the pandemic, they've been trying to keep trainees out of the hospital as much as possible, but Trevor, Mary, anybody?
Right. Well, I believe both Maggie and Eleanor were in similar, but they're both philosophy PhDs. So it might be helpful for them to talk a little bit about their experience. But in addition to that, I think one of the things to remember is that part of the reason why we're looking for folks with clinical experience isn't just the mere fact that they happen to have been in a hospital or nursing home, but that they've had the chance to exercise some of the skills that are important of doing clinical ethics. So, for example, one of our previous fellows, he was kind of familiar with what goings on of a hospital, sat on an IRB, but didn't really have a whole lot of experience beyond that. But what was important and what he made the case for was that he spent quite a bit of time doing some journalism. And he argued that, well, think of all that is required to be a good journalist. You have to be attentive, ask good questions, get people's buy-in, build rapport with people over the space of just 25 seconds. So even though he didn't have a whole lot of clinical experience, he had some. But there are other types of experiences that y'all might have that would lead you to say, okay, I can do the things that a clinical ethicist might do. So so clinical experience is important, but also doing the things that you do in the clinic as a clinical ethicist. That's another way to, I think, kind of think creatively about why you might be a good candidate.
And if I can jump in just for a moment, I think one of the ways that I, as a philosophy PhD, sort of showed that I had some of these skills. I was in the same situation. I was sitting on a community hospitals ethics committee, but I also had the experience of being the designated surrogate multiple times for my father and for my husband. So I was able to sort of talk about how exercising those powers changed the way that I thought about the sort of theoretical questions around what happens in a hospital, and gave me some sort of firsthand experience as a family member of what kinds of ethics problems can arise in hospitals. And so there are different ways that you can kind of develop or sort of demonstrate that you've got the relevant experience.
Yeah, I'll add on too. So I kind of knew I wanted to do clinical ethics before I knew I wanted to get a PhD in philosophy. So I may not be the right direction to really give a lot of advice on this, but I had done some shadowing, which again, with the pandemic might not be helpful. But while I was in graduate school, I was able to sit in and be a member of an ethics committee that was more oriented towards applying research to their clinical work. So they weren't clinical ethicists, they were other healthcare providers. And we had a bioethics, clinical ethics sort of journal club where we talked about what was relevant and what wasn't from the articles we were reading. And so that was one way I could sort of keep in touch with what some of the pressing concerns were for practitioners at the time.
Great, thank you. We have a couple of other questions about how many applications do you receive per year. I think that varies somewhere between 70 and 90, maybe, in that ballpark. So quite a few applications. How much are fellows paid? that is tied to the NIH postdoc stipend, which I believe is around $53,000 in that general area. It varies a little bit from year to year. We do have some of our colleagues who are part of our clinical ethics team here who largely work at the Baylor St. Luke's Hospital, and I was wondering if Dr. Fedson or Dr. Childress or Professor Horner want to jump in and talk a little bit about that part of the program. I know we talked largely about what they do at Houston Methodist because that's the bulk of the time, but if you guys are on and want to chime in.
Sure. Hi. I could chime in and then hopefully Andrew can. I'm Savi Fetson. I'm one of the center faculty, and I do all of my clinical work in ethics over at Baylor St. Luke's and also actually over at the VA Medical Center, where I am a practicing cardiologist as well. And the way we try and incorporate the fellows into the program over at St. Luke's is sort of twofold. The first is to get some experience with policy writing. And we realized this was important because as people leave fellowship and go into different institutions, often it falls upon people in the ethics committee to either write or certainly review hospital policies. So having that experience of sort of seeing from the ground up how policies are either conceived of, how they're worked through, how they're written, and then how they're actually pushed through the hospital administrative systems and executive committees to become sort of either hospital-wide or in our case at Baylor St. Luke's, actually system-wide to many of the other different hospitals that are part of the Common Spirit Health in Texas. I think it's a useful experience wherever you end up. So that's one way we start getting the fellows involved with us. And then fellows will have an opportunity to come over and work with us, not so much to take first call, but they'll always work with us. And I think the advantage of that is twofold. The first is it's a different system. So you have to, the establishment and sort of the integration of the clinical ethics program at St. Luke's isn't quite as streamlined as it is over at Houston Methodist. And we do probably about a fourth of the volume at this point, as we're rebuilding, sort of reinnovating the program. And I think working in a hospital where it's not as well recognized, it's not sort of the default, oh, ethics is here, but having to make ourselves known and visible so that people will call us, I think is an interesting way, or having to explain more often what it is that ethics is, I think is useful. But also it is a Catholic hospital. And because of that, we actually have to abide by the ethical religious directives of the Catholic Church, which prior to my coming here, I probably had a very biased, not probably charitable and just an ignorant understanding of them. And they are actually incredibly useful guidance and directives that we have to follow about end-of-life care. Specifically, we don't have an OB program, so it makes it a lot easier. But I think realizing how different religions interplay in the interpretation of this in very much a sort of forefront way is useful. One of the grand rounds that we hold every year is actually an interfaith panel where we take topics. We've had artificial nutrition hydration, we've had end of life after brain death and organ donation, and we've had it from the perspective of sort of Catholicism, Christianity through the eyes of a Presbyterian minister, Islam, sort of, which I know is a huge range of things, but sort of our Islam chaplain our Muslim chaplain does a really good job trying to explain some of the differences, and then Judaism and Hinduism. And so really looking at how different religions take these ethical topics in medical bioethics and clinical ethics has been really, I think, enlightening to me. I've learned a lot, but I think having a period of time where you have to really pay attention to those features has been useful for the fellows. But I'll stop there. And Andrew, I don't know if you want to say more, because you're certainly very embedded.
I actually don't have any much more to say than that, Savi. I think you covered all the really important points. I would just emphasize that it is a different environment, and kind of building those relationships with clinicians who are not really sure what we're doing. It does take a lot of time, and we're doing some new things in terms of educational involvement with the units and a different approach to ECMO consultations. So it's I think a great benefit to have this ability to see how clinical ethics is done in two pretty different environments. And that's pretty much all I'll say about that.
All right, well, you can see our contact information here. You're more than welcome to reach out to us at any time if you have any questions. I believe the fellowship applications are due October 29th, but we'd be happy to respond to any questions that you might have before then. And there's also some more information, as you can see here, on our website. So thank you very much, everybody, for joining us. And I hope you stay safe and have a good rest of your day.